Yeah.
Hi, this is Rajib Mandal and we will give a demo today for a low vision assessment from the beginning to last in step by step. So today we got a case of macular dystrophy, and in that for doing this case, patient will be having a central scotoma usually, and this patient will be usually get good visions after or improvement by basin prism with adding high plus lenses and with room illumination. So before that we check room illumination is good, can help for the room. Okay, now we'll call the patient and do the assessment by step by step. Please come. Assessment, right, for macular dystrophy. Okay. So I'll ask you a couple of questions to understand your detailed problem. Okay. So as you can see here, you are a student. Okay. What except the reading book, any other hobbies you have? No, you don't have any hobbies, correct? So now, any difficulties you have for blur, what kind of difficulty? Blur vision is there for distance or near? What kind of difficulties you have?
For distance, it's a blurry vision.
You are having distance vision.
Yeah, for near also.
Near also. Okay. From how many months you are having this? Okay. Cool. So how can you manage it? Is like when you're reading for near this thing, can you manage with a close distance or you are having some difficulty to read that?
With close distance, I can read.
Okay.
But far, I'm having difficulty.
Okay. 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 So except reading, like once you read this thing, so where everything is comfortable, or there's little difficulty you have to read that, or to get it too close,
Yeah,
right?
I have to get too close to it.
Okay. In distance properly, what kind of problem you have, like in the central portions or the periphery, like outside?
Only in the center portion.
Center portions. Okay. And if you come to light room to dark room or dark room to light room, there any problem is there in that? Once you come to that, can you adjust with that? How it is that? Like, can you adjust with the dark light to light area to dark area?
No, I need more. I need more light.
You need more light for that. Okay. You have any problem with walking? Anything like you can walk alone, or it is difficult?
But it's difficult.
Difficult. Okay. So you are using spectacle already. In the family, anybody is using spectacle?
Only my dad.
Okay. So you can see here from this they have mentioned it is a visual acuity. Okay. And left eye is the preferred eye. Okay, we'll check that and we'll make it. So you need more light to adjust in the reading or anything, correct?
Yes.
Okay. And once you walk in the road, do you have any problem with that bumping of the object?
Sometimes.
Sometimes you have it. Okay. Any other daily activities where you are feeling difficulty? Any specific things are there? Except the reading problem and this one? No, correct? Cool. So we'll check one by one on this step. Okay. 2 steps you should do, and then we'll go for assessment of that. Okay. Okay. Can you read that?
S
Hmm.
R
Hmm.
K
Hmm.
N
Hmm.
C
Okay.
A.
Hmm. Next. Bit blurry. Okay. Okay. And check other eye.
B S R K N
Hmm.
C K Z O
Hmm.
H
Hmm.
O N R K D next.
You can't do it. Yeah. Okay. We'll check near vision now. Okay. Up to here you can see.
2 0
Hmm.
5.
Hmm.
Next.
That's all, no?
Yeah.
Okay. Check your other eye.
2
Hmm.
0
Hmm.
5
Hmm.
3
Hmm.
6
Okay.
4
Hmm.
4 9 5 2 6 0 4 9 next I can do.
You can't do it. Okay. Next we'll do retinoscopy. Okay. To check that if any the power correction is there or if any changes there. So we'll check one retinoscopy power and we'll finish. Okay, if any correction is there. Two lenses. Look at the behind target. Yeah. Okay. Almost your power is quite same. Okay. So let's check it. Now we will check your clear. So can you close your right eye now? Yeah. Now read that. Is it readable? Hmm. 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 Okay. You close other eye. Can you? That's all. Okay. Stop it.
DSNCKRZDR
Hmm.
NDC, that's it.
Okay. Close your other eye and check it.
HSZDSNCKRZDR NDC OSKOZKVH, that's it. I can't.
You cannot read. Okay. Check confrontation test. So what we'll do is, can you see my both the hand?
Oh yeah.
Yep. Is it clear? Can you close your right eye? Yeah. Now my hand is visible. Okay. Now how many fingers I'm showing it? One. Okay. Here. Okay. Here. Okay. Now. Now just follow this. Okay. And tape. Okay. Is it visible?
Yeah.
Okay. So tell me when it is visible. Okay, visible. Okay. Till now it is visible, correct?
Yeah.
Here. Visible, correct? Okay. Here. Okay. Right. Documented her distance vision. It was in OD 6/36. Okay, and left eye 6/24. And so if you are taking block mode ETDS chart, your OD is 0.77 and OS is basically 0.60. And distance near vision is N36 with base correction by 40 centimeter, and left eye we have N10 to 46. So as he is the patient, okay, we have to calculate now for distance. For targeted visual acuity, basically we have kept at 6/12. Okay, now 6/12, and what is our base corrected visual acuity? 6/24. Yeah, so 24/12 we have to make 2x magnification. So as of now in the clinic we have the options, that is monocular handheld telescope, spectacle mounted telescope, binocular telescope, CTV, clip on, bioptic telescope. So these are the options we have. But as he is a student, we will prefer for giving either a CTV or we can give for spectacle mounted telescope. We will try with that, and that magnification will be 2x. Okay. Now coming to the near vision, how it is? BCVA for her is N36 and N10 at 40 centimeter. So our targeted visual acuity, as is a student, we should give N6. Clear? So magnification should be BCVA by TVA. So 10/6 is 1.66, and threshold magnification is basically, it should be 1.6x. Now to facilitate that, we need 2 multiplied by whatever you got threshold magnification, that is basically 2 into 1.6, that is 3.2x. So if you give this magnification, patient will be more easily, with ease patient can read that without any difficulty. Okay. Now to calculate at what distance patient should read that. So basically EVD or equivalent with distance is what? Previous distance reading whatever patient was there with magnifications. Okay. So magnification we have made 3.2, and patient was reading at 40 centimeter, we have already documented. So 40 by 3.2 is, in meter we can calculate 0.125. Okay. Now EVP we should calculate what is the magnification we need for the patient. So for her EVD we got 0.125. So magnification will be 1 meter by 0.125, that is 8 diopter. But if we prescribe 8 diopter for near, okay, we need a basin prism for her because her central vision is already gone. And second thing, to make the convergence demand, because if you put 8 diopter, we had a high convergence demand, and that to be compensated with basin prism only. So rules for that is spectacle magnifier, if you are prescribing, as for example, for spectacle magnifiers 8 diopter, we should add whatever magnification you are getting plus with that plus 2. So here we got 8 diopter plus 2 diopter. For now we can read correct magnifier. Okay. Now can you read that with this?
BSR CKZ
Next.
OH ONRKV
Okay.
KZVDC
Okay.
VSHZ2.
Good. Now it is complete. Now we'll check for near spectacle magnifiers. Take it out. So this is, with this it is easy for reading, correct? Can you read this?
205 364 4952 60493
Okay.
593206
Okay.
0469536.
Okay. For any kind of low vision patient, once you assess, before that we should make sure that we are taking observation from when the patient is entering to the clinic, and then we should take how they are walking, how they are coming either with any attender or they are coming by alone, how is the mobility. After observation, we should start a detailed history of the taking patient. We should know even the economical status of the patient to understand what type of device will be affordable by this patient. And then we should understand what is the basic need of the patient so that we can give a suitable correction for that. And then if you consider this patient as a macular dystrophy, what I got now, this patient at final we have given CTV 2x for the distance, and near we have given spectacle magnifiers which is at 8 diopter. With that, to make accommodative demand, to reach accommodative demand, we have given 10 diopter basin prism for each eye. Patient was advised to keep a good illumination in the room and the accommodation area, where even with the spotlight was advised to use when patient is reading with a flexible hand, and with that a proper shade so that much of amount of glare is not creating from that. And along with that, patient was advised to use a broad light area where for walking and the mobility, to help in the mobility in the local area. Along with that, to make sure the patient is getting a proper viewing, even along with the CCTV, patient was referred for giving eccentric fixation training. So with the eccentric fixation training, patient will get a proper view, as because patient is having a central scotoma. So this eccentric view will give a little help to the patient to see properly for the distance object also.